Hi, this is John Kanelopoulos from our center here in Athens, Greece. Very interesting presentation for us. This is the usual Avastin solution that we use as an anti-VEGF factor for mainly wet macular degeneration, but also branch retinal vein occlusion and diabetic macular edema. We were the first team to use this and bring it to Greece back in 2006. It has since, of course, been a global sensation and a solid treatment for patients with a need for anti-VEGF. Of course, with the other medications that came along, Lucentis, Elia, and lately Beovu. Now, this is the traditional syringe. This was an insulin syringe that we used, and most people use. It's made by BD. No big deal here. It's a 1 ml syringe. It has each line is a 0.01 ml, so 10 lines are 0.1 ml. And usually we load 10 lines on this insulin syringe. And what we'll do is, one of the problems with the syringe is that end chamber made to foster the needle capsule. And a lot of the medication gets wasted because it is left in that needle capsule. Now, we've used BSS just for demonstration purposes. We've colored it here so you can see more easily our technique. We're going to draw with a 25 gauge needle the colored BSS solution and prepare it as if we were going to administer this anti-VEGF injection. We're going to switch needles to our usual 30 gauge needle, load the medication to read 10 lines, and usually inject at least 7 lines intravitreally. So this is our in volume typical preparation for our anti-VEGF injection. So we're going to show you here an alternate method. This is a different syringe called Soft Care. These are the characteristics of the syringe. And the difference is just at the end chamber of the syringe. You can see it has that black rubber plunge which enters the chamber onto which the needle engages, thus leaving no space there, no wasted fluid, medication, whatever is used in every specific occasion. So we're going to do the exact same experiment. We're going to use this syringe now with a 25 gauge needle to load the solution. This is again colored BSS solution for demonstration purposes. We're going to trim it down after switching the needles to a 30 gauge needle to read 10 lines, so a total of 0.1 ml of the solution. We're going to bring these two syringes now side by side for you to compare. So on the left side is the first typical syringe we've used up till now, and on the right side the new proposed syringe with the plunger. We're going to empty the solution as if we were administering the injection, and then we're going to use the syringe itself to measure the volume of the fluid left over. So we're drawing back. We can read here we have about 6 lines on the insulin syringe of leftover solution, which obviously we cannot use. It's left in the syringe chamber. Now we're going to draw the second syringe, the one we proposed to you. And although, remember, there's still the plunger within that syringe space, taking up space, it reads only 4 lines, so this represents less than 2 lines of fluid volume left in there. So between the two, we are comparing 6 lines left over to 2 lines left over. It is less than 60% less solution left over. So we have since discovered a significant difference, adapted the syringe number 2, the one on your right, in order to preserve the anti-VEGF solution. In my opinion, it's absolutely necessary in Lucentis injections where the solution volume is very small and some of it may not reach its given target, which is the vitreal cavity. This again, demonstration of the syringe specs, and again, the only novelty that it has that rubber plunger that enters the syringe chamber onto which the needle engages. And I think This will be interesting for anybody who uses anti-VEGF injections. This is John Canelopoulos signing out, and thank you very much for your attention.